If you're thinking about a facelift, I'll explain the steps I do in my deep plane face and neck lift. Now we come to the face. The drape of the face is called the SMAS, Superficial Musculo-Aponeurotic System. And that is a fascial layer and a muscular layer that drape the skin. The facelift was done by just pulling the skin, skeletonizing the skin of the face, and then pulling the skin. Then they started placating the SMAS underneath the skin. But we realized that once we're doing this, we're also pulling the deeper layers of their normal position, which causing a bit of an artificial look, pulled up look, or a facelift look that people could catch. And also, because of the tension and counter-tension, the ear could get pixied and the scar will stretch. So it can form some form of tension, which is destined to failure with time and age. So the new technique, which is the deep plane, we do the following. We make small release of the skin alone close to the ear, and almost after a few centimeters, we dig deep into the deeper layer. It's called the subsmas layer or the deep plane. We release that layer and we lift it like we lifted a carpet of the glue underneath it. And then once we lift it all the way into the anterior face, we can just pull the excess into the direction that we want without change of the position of the mimetic muscle. And this will keep the natural look. And this will keep the mimetic muscle intact. Once we fix it without tension into the appropriate angle, then the skin could be removed and tailored without tension. Therefore, the scar will be almost non-existent, especially in the non-tension area around the ear. After trimming the extra skin, whatever left is a skin that's been supported and augmented by the SMAS, because that skin and the SMAS never been separated at all from each other. That skin is healthy, it doesn't have lumps and bumps, it doesn't have darkening, it doesn't have a new vascularization with a microvessel that pops up in some facelift patient that we used to see in the older technique. Therefore, it heals quicker and faster. In the neck, we often see increase in the volume and laxity of the skin and the muscle. We have to correct skin, muscle, and volume. I start usually by making a small tiny incision underneath the chin, very well hidden, close to the crease or on the crease. I release the skin from the platysma muscle. If there is excess volume underneath the platysma, then I reduce it gently. I try not to do an excess reduction in the central part of the neck, because if we do this, which is often done by a surgeon, the result is usually something called cobra neck, so we try to avoid it. However, if there is a big volume or bulky digastric muscle here, then we can shave it or we can remove it. But more importantly, we have to look for any increase in the volume laterally on the side, underneath the jawline. Often is caused by the submandibular gland. The submandibular gland gets bigger in some people with age and also get pushed down by the gravity and by the volume in the mouth. So it could cause fullness. And this fullness, if it's not corrected, it could lead to failure of the face and neck lift, or it could lead to some bulge that I see in people who comes to me after receiving the face and neck lift somewhere else. If I see any increased volume of the gland underneath the hyoid bone or the jaw, then I shave it. This will actually cause a bit of a hollowing here, which further define the jawline. Once we reduce the volume in the neck, then we tighten the platysma muscle. Those muscles get loose as we age. They get tethered to the skin as they get weaker and causing those bands that we see in some people. The platysma could be short in some people. So if we tighten it here, it could tent in the lower part of the neck. In order to prevent that, we could cause a small release of the platysma underneath the hyoid bone. So once we make a small tiny release, the muscle relax down and allow the muscle above the bone to tent up and produce a more of a defined neck and jaw. So once we go into the lateral part of the neck correction, we do something called the platysmal hammock or platysmal sling. The strong part of the platysma muscle here get a bit released. We can lift it and elevate it, allowing this hyoid bone to be elevated with it too, which will improve the angle between the mentum, which is the chin, into the hyoid. If the angle between the mentum and the hyoid is low, then you're going to have an oblique shape like myself. Elevating the hyoid bone will help improve the shape and the angle in the neck and the jaw, which will give a bit more youthful shape. We often supplement the facelift with additional procedures, especially volume augmentation. When we see with aging, we have a volume depletion, especially around the eyes with the hollowing in the lower eyelid, and also in the temple area, into the pre-jaw area. So we add volume into the face that will restore some of this smooth look to the face that could be long lasting.